Hello and welcome to the Queen Elizabeth Patient Podcast. My name's Caroline Tweedy. I'm one of the breast specialist nurses at Queen Elizabeth Hospital, also working in personalised care. I'm here today at the Proto building and I'm here with Julie Lamb. She is one of our lead cancer nurse specialists and just here today to talk about National Clinical Nurse Specialist Day, and we're going to discuss a little bit about the role and a little bit background with Julie and how she came to her role today. So hello Julie and welcome.
Hi Caroline, thanks for inviting us.
So Julie, you came to join our team at the Queen Elizabeth Gateshead in September 2019, but prior to that you've always had a degree of background in cancer services. Can you just tell us a little bit more about that?
So I've been a nurse, Caroline, for 36 years, but really all of my career I've worked in cancer and palliative care, and my last few roles I was a clinical lead at St Benedict's Day Hospice for a couple of years before I came to you as the cancer lead nurse, but before that I was a cancer nurse specialist working with palliative care patients. So they were primarily cancer patients, but they were patients whose illness could no longer be cured. So what I looked at was working with the patient and the family to make sure that we got the quality of life as good as it possibly could be. So looked at the symptoms that they were having, any chemotherapies that they were having, to try and make it really as good as it possibly could be. So that was my kind of background into cancer nursing, and I spent about 15 years as a cancer nurse specialist before coming over to Gateshead, and I've been the lead cancer nurse in Gateshead for the last couple of years.
Yeah, and I suppose it's a very varied role, you know, when you're dealing with the clinical side of things, you know, and the expertise that you've needed as well, you know, and obviously you were able to transfer a lot of that into the role that you're doing now. So can you tell us a little bit about that transition into the role that you're currently doing now?
So I think I've always been really motivated about cancer nurses, and I've always thought a lot of the times that cancer nurses are really very invisible until you actually have cancer, but the cancer nurse specialist role is really key to the patient's journey, and it's really key to how we look after the patient. And I think the most important thing for me is that our patients in Gateshead and across the region actually feel safe. And I think one of the main reasons that we do that is by having really good cancer nurse specialists working with them.
So Julie, the role of this clinical nurse specialist, I can imagine over the years that you've spent, has changed. What would you see was probably the most dramatic change as the clinical nurse specialist in your experience?
I think we expect so much more from the clinical nurse specialists. I think when clinical nurse specialists first came about, it was very much that there were somebody that would just hold the patient's hand and do what the doctor asked them to do. And I think now that has completely changed, and I would certainly still want them to hold the patient's hand and make sure that they really support the patient. But I think that we expect actually that our cancer nurse specialists are experts in the field. So we have cancer nurse specialists who work in lots of different specialities. So we'll have cancer nurse specialists in breast, cancer nurse specialists who work with upper GI patients or patients with a bowel cancer. And all of those nurses need to have core skills, but they also need to have really expert skills on how they manage that patient. So the nurse who works with the bowel cancer patients needs to know as much as possible about bowel cancer so that she can help navigate that patient through that role and through that illness. And I think so that's a big expert in what they need to know. But also if you think about all of the new treatments that there is now as well, there's so many different chemotherapies, and we expect our cancer nurse specialists to know about all of those treatments. And if they don't know, we expect them to make sure that they go and find out so that they can really help the patient.
So it's about that relationship sort of even, you know, once upon a time it was very sort of paternalistic, you know, we'll tell you what to do. Yeah. Whereas patients they've changed over the years as well. I've seen patients, you know, incredibly intelligent about, you know, what they're going through, and they go and do their own research and they come to you, and like you say, there's an expectation to know that. Yeah. You know, and like you say, there's a lot of pressure on the clinical nurse specialist, but, you know, you want the best for your patients, which is what we're striving for.
Definitely. And I think we also have to be really mindful of Dr. Google. So our patients can come to us and say, I've looked at this and I've looked at that. And some of those things are really important and really helpful, but some of the other is not evidence-based at all and can actually be quite dangerous. So I think as a specialist nurse, you also have to have the skills to be able to say to the patient, well, that's good that you're looking at all of these things, but actually I would be careful about that website. There's not a lot of research behind it. And I think that's really important for the cancer nurse specialist. So I think there's that clinical role with the patient and the family, but I think the other part of the cancer nurse specialist role is, so as an educator, so what we need to make sure is that our general nurses who are working on the wards really see the cancer nurse specialists as experts and aspire to be them, if I'm honest. I know certainly when I was a staff nurse at the Queen Elizabeth, which was a long time ago, I saw a cancer nurse specialist on the ward. She was really good. She was talking to a patient, and that was where my career ambitions came from. I thought, I want to be like that nurse, and I want to know as much as she does and be able to support my patients like she did. So I think cancer nurse specialists really need to be key to all of our more junior staff as well, so that they can see what the role of the nurse is in cancer and that they can aspire to that.
And I think as well, working as a general nurse on the ward, we've both been there and we know how hard it is. And, you know, I think that was one of the reasons I came into the job, was that it's so difficult to have those difficult conversations in that environment. And like you say, I remember watching Lynn Pounder, who actually I share a desk with now, and you know, I was a junior nurse at the time when she was a breast care nurse, and I remember she asked us to come into a conversation she was having with a patient, and the relationship she was able to have with that patient and the openness, and you know, it was so fantastic, which was so difficult to be able to nurture that kind of relationship when you're in that environment. And that was certainly one of the things I came into the job, and I really do remember, but appreciate as a general nurse wanting to do that sort of role, but being so restricted in that ways as well.
Yeah. Yeah, and I think that's what's been difficult really, because we've got cancer nurse specialists and they're all in different tumour groups. They're all really busy, and actually what we never get is a chance to be together and a chance to work together. And I think from my lead nurse role, that's what I wanted to do across Gateshead. I wanted to make sure that all of the cancer nurse specialists knew each other, that they supported each other, so that when we got junior staff in post, that we could make sure that the junior staff were supported by the more senior staff, irrespective of what tumour group they were working with. And that's what I've tried to do over the last couple of years, and I think this is why the Cancer Nurse Specialist Day on the 15th of March is really key for us to be able to celebrate cancer nurse specialists across the region and across the country, to actually make sure that we show that how experienced we are and how vital we are to the patient's journey.
In a job that, you know, I thoroughly enjoy doing every day, you know, and what we want to do is encourage those nurses who are maybe working in sort of maybe more generic jobs and who are enjoying it and picking up that experience, but maybe see something in that job, like I did with Lynn Pounder, that, you know, they want to progress with. What would your advice be for maybe some of the junior nurses who are wanting to aspire to be that role or that level of speciality?
I think what they need to do is, if possible, spend as much time with a cancer nurse specialist as they can. So when they're writing the personal development plan, ask to spend time with the cancer nurse specialists. Also, you know, take the opportunity of looking at, there's a lot of online courses and things that you can do. There's a lot of Macmillan links on the Macmillan website that will help nurses who are aspiring to be cancer nurse specialists. And I think you just need to look around and spend time. And I think it's also not just spending time with the cancer nurse specialists, but spending time with the cancer doctors as well, so that they can actually see what the role is about. I think a lot of people will say to me, oh, I wouldn't want to do that, must be really sad, your job must be really sad. But actually, if you talk to any cancer nurse specialist, you'll probably find that actually they don't say that at all, and that actually what they say is that the job is really enjoyable, really fulfilling, and that at the end of the day they really go home thinking that they've made a difference. And that is what we want from cancer nurse specialists. We want it from every nurse, if I'm honest, or anybody who works in the NHS, but particularly for our cancer nurse specialists. We know that we make such a difference, and we need to make sure that everybody else knows that as well.
So Julie, I think every nursing profession would agree that the last sort of 2 years has been extremely difficult. You know, we've been put in very difficult circumstances, and you know, we're now in February 2022, and we're hopefully coming out the other side of things. And you know, the likes of Macmillan and the Trust is really putting this recovery plan in place. How, as a lead nurse, do we kind of move on with everything and give that support to patients?
Yeah. And I think that's been really difficult. I think the last 2 years have been absolutely horrific for patients, but particularly for cancer patients, because they've been really scared. They've heard lots on the news and in the media that actually, the cancer backlogs are huge and people are really frightened about that. And I would say for patients who do feel like that, they must make sure that they contact the cancer nurse specialist and talk through, because really, realistically, we do have cancer backlogs, but we have certainly throughout the 2 years really tried to make sure that cancer patients and cancer surgeries and treatments continue. So the news can be really scary, but actually if you talk to a cancer nurse specialist, you'll get a better understanding of that. And I think really what we have to do is just try and recover. We need to reset a little bit. I think it's hopefully now in February we've got a little bit of a chance to catch our breath and think, right, okay, these 2 years have happened. Hopefully the numbers are going to continue to come down, and we need to just think of how do we recover. And a lot of the things about recovery is actually thinking about some of the innovations that we did when during COVID, when we couldn't see patients, and we had to do telephone conversations and telephone appointments, which aren't ideal, but we actually showed that they could work. And I think also some of the other things that we've done, Caroline, if you think of all of the podcasts that you've worked on, we would probably never have thought about doing them had it not been for COVID.
It really forced our hands.
Yeah, it forced our hands. It made us think, oh God, we're really nervous. We don't want to sit in a studio. But actually, we've showed that we can do it. And now our podcasts have, been recognised nationally as how helpful they are. And I think what we need to do is take that innovation and run with it. And we need to make sure that we have everything digitally and face to face if we can. So that would be my vision, that we would be able to do that.
Together we've done some work, because one of the things that kept coming up, because yes, frontline COVID was very much seen as ward-based, but we were very much frontline when it came to the cancer patients, because like you said, there were, most patients were dealing with cancer and uncertainty, but the uncertainty of where the treatment was going to lie, who were they going to see, and there were so many elements of that, and the isolation kept coming, you were on the phone to these patients, it might have been the only phone call that they'd had that day, and I think, we seen that there was obviously an issue there, and a lot of the virtual group sessions that we've managed to produce at the Queen Elizabeth have evaluated so well. And like I say, a lot of the evaluations that are coming through for these sessions, patients were saying, it was nice to know I wasn't the only person in that boat, and to share those experiences together, to me, is like I say, I would never have been able to do that had it not been for COVID. So it was a positive thing, and hopefully we'll go from strength to strength. And the money that saved, because again we'll come down to finance, and it's expensive to have cancer, especially now with heating bills and utility bills going up, that the virtual sessions is certainly for a lot of patients was a lot more convenient. There's more people that have actually got hold of a smartphone than that have the personal use of a car, and then you've got your car parking and everything else that comes in that. So hopefully it's a practice that we can maybe go back to face eventually, but also give that menu of options when it comes to information and support.
Yeah, and that's what I think we really need to make sure that we've got. We need to make sure that it's all accessible to our patients, and that they can have it in any way they want. They can have it digitally via a podcast, they can have it written down into a leaflet, or they can come to an event, and make sure that we cover all bases. And I'm just going to take you back to that point that you said, Caroline, about the patient feeling isolated. I think that was also the case for some of our cancer nurse specialists, because we were pulled in a lot of different directions, and I think that was hopefully what I've tried to achieve in my role as the lead cancer nurse, is for us to at least meet regularly to be able to talk through what our problems are, and get solutions from each other. And I think that's what we've seen, and that happened in Gateshead, and I know it happened in other trusts as well, but I think it also happened with the lead nurses, for the lead cancer nurses across the region. We met regularly during COVID, and will continue to do so, and also shared our own stories of how we could support our nurses, because as the lead cancer nurse for the trust, yes, I need to make sure that we recover cancer, but I also need to make sure that I recover our cancer nurse specialists as well. So I think it's also the 15th of March is an opportunity for us to celebrate, and to celebrate how good we are. And I don't think as nurses we say that very often, but I think we need to celebrate how good we are, and also make sure that everybody else knows it, but also celebrate, just even if it is just for a few months, that we might be out of COVID, and that we can actually get back to our day jobs.
Yeah, and like I say, it wasn't all negative. From that we've got some really great practice, and it's given us the confidence to think, we can do this, and we can go. There's never a ceiling, I suppose, when it comes to good practice and, and achieving the best that we can. And like I say, we've had great leadership throughout the COVID, thanks to yourself and keeping those forums going. And like I say, it was an area to, where it was safe, we could discuss things, and there's no judgment as well, which was a great sort of forum to be able to do that.
And I think as well, it's sometimes when I first came into post, it was sometimes, we can't do that, and it was a challenge for me to go, well, actually, why can't you? You're a force in this organisation, you're a good big group of cancer nurse specialists. Why can't you? Let's push boundaries and let's make changes. And I think some of the things that we've done in the personalised care agenda, looking at how we record holistic needs assessments, look at how we do stratified follow-up, all of those things have pushed boundaries for us that we really thought when we looked at them, we can't do that because that system doesn't match that IT system. But actually we've showed with a bit of concerted work that we can. So I think we just need to continue that.
And I think we've gained a few extra wrinkles throughout the process.
Yeah, I think it did really show that as cancer nurse specialists we weren't massively engaged with technology, and I think we had a few hairy moments, but I do think that we've kind of got there in the end.
And I think probably the best way to to learn is through sometimes making those technical errors.
Technical glitches, yeah.
It was definitely operator error at times. But yeah, we've come out of it hopefully the other side, and hopefully, the Clinical Nurse Specialist Day on the 15th of March is an opportunity to celebrate, what we've done and what we can go ahead and continue to achieve. But thank you very much, Julie, for coming today.
Thank you, and thanks for all of your hard work.
Thank you.